It's very difficult because it was breast cancer and is still, and was more so then, seen as a woman's disease.
I thought it wouldn't be possible, but turned out that it was possible. In fact, I had it on both sides.
The simplest answer is that everything boils down to genes and environment.
We're all completely devastated. My mother, my sister and I. And
it is still a taboo subject.
Every 2 minutes, someone in the UK gets diagnosed with cancer. Since the early 1990s, breast cancer incidence rates have risen by almost 20%. Despite the fact that breast cancer can affect mostly women, and that's around 55,000 of them, it can happen to men as well. My name is Bruna Tomsitz, and I'm here to explore the possible treatments, support, and research available to men. Find out what triggers male breast cancer, as well as could male breast cancer potentially be more aggressive than in women. Even though breast cancer can affect more men in their late 70s, a former GP from Towcester got it when he was only 57. Back in 2014, he found a lump on the left side of his chest.
It is rare. I'd never seen it as a GP, you know, being a doctor for 35 years or whatever. I guess that's why we thought it wouldn't be possible, but turned out that it was possible. In fact, I had it on both sides.
What sort of things did you have to go through?
I went through surgery, as you say, so I had a double mastectomy. At the same time, they checked to see whether the glands in the armpits were positive, which they were. So they ended up doing a clearance. But I think it's purely that men turn up later. I think men get a lump like I did and think, you know, it can't be cancer.
Throughout his treatments, Michael had the support from his family and his wife Jill. But even now, there are so many unanswered questions regarding his disease.
Just I wonder why Mike got the breast cancer when he has an identical twin. So therefore they both have the BRCA2 gene. But obviously something has triggered it in Mike. And what is it? Is it stress? Is it diet? Is it, I don't know, the environment? Is it your work? What is it? But of course no one can give us any answers. Shocking. Never thought, you know, that he would have breast cancer. Never even occurred to me when he first said he got a lump in his breast and I felt it. I never thought it would be breast cancer. I mean, we've never seen it in a man before. So obviously, as doctors, we've seen it a lot in female, or we've felt a lot of breast lumps. And I would say the Mike's lump didn't even feel like anything that I'd felt in a lady's breast.
Michael is now out of remission, but this is not the case for all. I travelled to London to meet with Lord Howard, whose father passed away in the 60s due to breast cancer.
he died 6 months later. Now, there were treatments and all sorts of treatments were tried, but sadly none of them worked. We were all completely devastated, my mother, my sister and I, and the other members of our family. I was 24. We tried very hard to make sure that everything that could be done was done, and I think it was. Of course, there's been a lot of progress since, but it's of course the case that it is an illness that definitely still needs to be addressed.
Every year, around 350 men in the UK get diagnosed with breast cancer. Out of those, around 80 men die. Comparing to women, more than 55,000 are affected and more than 11,000 die. But if we look at both genders' percentage of mortality rate, we can actually see that it is higher in men. Considering the fact that the percentage of mortality rate is higher in men than in women with breast cancer, there must be something else rather than just a late diagnosis. I went to see a Northampton surgeon and consultant to find out why is that the case and what role do genetics play in the development of male breast cancer.
My understanding is that if you have the same type of breast cancer in a man as you would in a woman, what we would say stage for stage, grade for grade, it's the same outcome. But the story is a bit more complicated. I don't think I'd seen a case of male breast cancer until after I was qualified as a consultant. So, because male breast cancer is rare. The simplest answer is that everything boils down to genes and environment, nature and nurture. Probably there's a whole set of genes, some of which suppress the development of breast cancer, others which actually actively promote the development of changes which lead to breast cancer. There are a few that are well recognised, and these are the so-called BRCA genes, BRCA genes. Some families actually transmit these, and in men, they are more commonly found in men with breast cancer than women with breast cancer. Breast cancer in men tends to present when they are older. It tends to present a bit later, and often there are what we call associated comorbidities, in other words, other illnesses that the men have, which perhaps stop more aggressive treatment.
So far, we've looked at the role of genetics and other factors related to the development of breast cancer in men. But are men supported enough during the process? An oncology nurse, Catherine Finnerty, from BMI 3 Shires, thinks there's much more work to be done in terms of raising awareness.
I think it is still a taboo subject. It is a worry because it is a disease that affects men and women. So I don't think there's enough publicised about it. Therefore, I think generally the men that I know that I've seen in the past that have had it are in their 40s. You know, they're of that generation where it's not acceptable. It's still like they have to be a man, so they don't want to talk about it. So there's not a lot out there from a patient's perspective either. And I just think if they made it more out there, then people would be pushing more for the charities to be raising money for the men as well as the women.
What kind of symptoms do you think both genders should look out for?
Well, obviously there's changes in the nipple area, any feelings of lumps, anything not just around the breast itself but under the armpit, any pain, any discharge that's coming from the nipple, anything that looks, if the skin colouring of the nipple or texture changes, anything that is out of sorts basically. Sometimes you might, because people always assume there's a lump. If you've got breast cancer, there's a lump. Not necessarily, you won't always feel a lump.
For someone currently seeking support, I explored what local charities are out there, not exclusive to women only. In 2016, a mom of two, Leni, got diagnosed with breast cancer. After struggling to find local support groups which would fit her needs, she decided to create her own. Her stepdad was also affected by breast cancer, but finds it really difficult to talk about.
He was a builder and a big strong man. It was very difficult because it was breast cancer and is still, and was more so then, seen as a woman's disease. It's a big sweeping generalisation, but men can be quite private. Men don't always talk openly. Women tend to congregate together. When asked, he said he wasn't offered support and he didn't get support and he didn't want support. It's very difficult when we are in a group of people that have had breast cancer, and to look at why we got it is something we will never know. People in the future hopefully will, and that's how they'll be able to hone in. But why we personally got it, we will never know.
So far, we've talked to people who never thought male breast cancer can happen to them, their families or friends. We've talked to healthcare experts and support groups, and everyone has something in common, and that is to raise awareness of male breast cancer. Despite the fact that complete cure for cancer still hasn't been found, there is still hope. The advanced medicine has shown that people affected by breast cancer can live longer, and everyone should have equal access to treatments such as mastectomy, radiotherapy, chemotherapy, and similar. Here is a final message from Jonathan Dawson.
I would like to remind you that breast cancer is treatable. Sometimes there are difficult things that people have to go through for the treatment of breast cancer, mastectomy, sometimes chemotherapy, but breast cancer is very treatable, and early breast cancer treated properly has a very high chance of being got rid of permanently.